live.
Okay.
Yes.
We are live. We are live. All right. Excellent. And we are live. Hello, everybody. It's Dr. Alex Earle here, and it's Hump Day with Dr. Alex Earle. This is the time we get to spend with you guys and answer all your plastic surgery questions. And today we're going to go over a very important topic. And then after that, of course, I'm going to be happy to answer any questions you may have. Remember, we can talk about anything regarding plastic surgery from head to toe, all right? But you may have heard, if you've been paying attention, that Pure Plastic Surgery here is a center of excellence for BBL and BBL safety, all right? And so there were several criteria for that, but one of the criteria was that we have to have lower complication rates than the national norm, okay? And so, yeah, that is exactly true. We have a lower complication rate here at Pure Plastic Surgery than the average national norms for BBLs. And so then the question becomes, well, Dr. Earle, how do you do that, all right? And so today we're going to go over all the things that we do here to lower our complication rate as much as possible, okay? Now, listen to what I said. It is to lower the rate, but it's not to eliminate the rate, okay? There is one that will be eliminated, which is the most important down here. But in general, the only way to have a 0% complication rate is to not do surgery at all, right? In the same sense that the only way to completely avoid a car crash is to never be in a car, right? So we can lower the complication rate, but we can't make it zero. But we do many things to get our complication rate here to either half or even less than half than the national average, okay? And that is what makes us, or part of the reason that makes us a center of excellence. There's many other criteria as well, which we've talked about in prior posts. All right, so let's talk about what are the possible complications after a BBL, and then what it is that we do to lower that complication rate, okay? So the first one is that I put on here is bleeding, or the need for a blood transfusion. Again, so we're able to lower this need as much as possible. Of course, it's not zero. So yes, I do hundreds of BBLs a year. Do I have 1, 2, maybe max 3 patients that may end up needing a blood transfusion? Yes, because I do hundreds of these cases, but it's less than 1%, okay? So what do we do to get that rate so low? Well, it all starts from the beginning, right? In order to even have a BBL, you have to have a hemoglobin level of 12 or above. So if you have a hemoglobin level that is under 12, then you won't be a candidate because the risk then for needing a blood transfusion goes up. The next thing that we do is that for all of our cases, so 100% of our cases are gonna have the cell saver, all right? What is the cell saver? This is a machine that we use at the time of surgery where we are able to remove the bloody fluid that comes out with the liposuction. We separate that from the fat. We then pass that bloody fluid through the cell saver, and then the cell saver is able to remove your blood from everything else, and then we can give your blood back to you. And therefore, the overall blood loss for the case is a lot less than it would be if you didn't have a cell saver, okay? And that way, you lose less blood, you recover better, you recover quicker, you bounce back, you're not feeling lightheaded, you're able to walk around and everything else. So the cell saver, I think, is very important. We use it here at Pure Plastic Surgery for 100% of all of our BBLs and Lipo 360s, all right? So it already comes with your package. Not every center has this. In fact, very few centers have that, and even less do so for 100% of their cases. But like we said, your safety is our #1 priority here, so that's why we do all of these things to keep you safe. All right, and then the next thing, which you may not think about, is that we use the vaser. The vaser is a device that uses ultrasound energy to help kind of knock off the fat cells from the surrounding structures. The technical term is called emulsify. So it emulsifies the fat, it knocks it off from the surrounding structures, okay? And then when I go in to then aspirate or suck out the fat, I can do so in a way that has less bleeding, less inflammation, and it also helps with skin retraction, which is awesome. So I can remove more fat with less inflammation, less bleeding, and better skin retraction. I mean, who doesn't want that? The vaser is excellent, and that's why, again, it is part of your Lipo 360 and or BBL. It is included with 100% of my Lipo 360s and BBLs, okay? So for me, for Dr. Earle, 100% of my Lipo 360s and BBLs will use the Baser for all of those reasons, okay? So those are all the things that we do to decrease the rate of needing a blood transfusion, all right? What's next? Infection, right? There's another one. So we want to decrease the rate of infection as much as we can. Our infection rate for the past couple of years has been about 1%, maybe 1.2%. I mean, that is ridiculously low for a BBL. I mean, after all, we're working in the butt region, right? But we've been able to get that infection rate extremely low. Rates like this are not seen anywhere else, okay? How do we do that? All right, first of all, antibiotics. Yes, we do use antibiotics. We are going to give you antibiotics at the time of surgery, and then we're going to give you oral antibiotics to use for 1 week or 7 days after surgery. But not only that, we put also antibiotics into the fat before we transfer it in. So you're getting IV antibiotics at the time of surgery, you're getting oral antibiotics for a week after surgery, and then we're also putting antibiotics with the fat before we transfer the fat into the buttock and hips. So that's a key thing there, multiple uses of antibiotics. The next one is the prep. So when we go to transfer the fat, before we do the fat transfer, so after the liposuction is done, but before we do the fat transfer, we completely re-prep the patient. We do a whole new iodine prep, and we also prep the cannulas with iodine every time before we place the cannula inside to do the fat transfer. What is a cannula? A cannula is like the little tube that we use to then place the fat. And so before we put the cannula in to place the fat, we also prep it with iodine. So we do multiple cannula preps with iodine, and we re-prep the patient before the fat transfer. What's next? Before starting the surgery, we always use ultraviolet light. This is something that we learned at the time of COVID. Actually, the reason why we brought the ultraviolet light is because we wanted to kill the virus, the COVID virus. But then we learned that, hey, even though COVID's not around that much anymore, that UV light did something great for our infection rate. It brought it way down. And so now we use UV light before we start any case here at Pure Plastic Surgery. Once again, only something that we do here at Pure. I have not seen this in any other clinic anywhere else. And I think that's one of the big reasons why we're able to bring that complication rate to 1% for BBL, which is outstanding, all right? And last but not least, the cannulas or the instrument that we use for the fat transfer, we change these cannulas out 3 times a year. 3 times per year, okay? We get brand new cannulas because we don't want anything accumulating in there. So, of course, we always sterilize them and everything else, but we go the extra step. Like I always say, we don't just talk the talk, but we walk the walk. And I don't care that it's gonna cost me more. Every 3 times a year, we change all of our cannulas to make sure that nothing gets in there and that we decrease that infection rate as much as we can. All right? Okay, so next is blood clots. Blood clots are the clots that can happen. Typically, they start in the back of the leg. That's called a deep vein thrombosis. Or from there, they can dislodge and go to the lungs. And that's called a pulmonary embolism. So blood clots, what do we do to decrease the risk of blood clots? We do 2 things. One is something that we do, and 2 is something that the patient has to do. Hey guys, remember, you have responsibilities here too, right? If you want the best results, you want to lower complication rates, you got to follow your post-op orders. So walking, all our patients are expected to walk at least 10 minutes every hour while awake. So you can't be laying in bed all day. That's going to lead to problems and blood clots and complications. And then the next one is the VenaPro. Again, something that we go the extra mile for. This is a device that we place on your legs. It's a sequential compression device. It keeps the circulation moving. You're going to be wearing this device for 2 weeks. It used to be called the Circulate. You may have heard me talking about that in the past. It's the same device. It just changed the name to the VenaPro. And so you use that for 2 weeks. Pretty much most of the time you take it off just to shower when you're physically walking and moving around. And the good news is that it's portable and you're able to wear that on the plane when you head home, which is extremely important, especially for any flight that's over 3 hours. So all of our patients get the Being a Pro as well. Again, look at all, look, going the extra mile, the salt saver. Going the extra mile, changing the cannula and the UV light. Going the extra mile with the Being a Pro. This is what makes a difference, is what makes us a center of excellence for BBL and BPL safety. All right, next, lipoburn. So how do we decrease the risk of lipoburn? Well, of course, primarily it's technique. If you are overly aggressive, if you take out too much fat, you leave the skin too thinned out, you're going to increase that risk of lipoburn. So I always want to leave about 1 centimeter of fat underneath the skin to minimize that risk. Also, leaving 1 centimeter of fat underneath the skin decreases your risk of fibrosis as well. And the other thing that we do, which is something that I started more recently, is that we don't put the faja on until the following day. So some of you that may have had surgery with me, say 2019, 2020, a few years ago, you guys will probably remember that you woke up out of surgery with the faja on. I no longer do that because I learned and I changed my techniques in order to continue to lower these complication rates. And so now we don't put the faja on when you come out of surgery. You're going to put the faja on for the first time on post-op day 1 after your first massage. And that way we can take a look at the skin, make sure the skin's looking good, that there's little to no risk of a lipoburn, and then we give you the go-ahead to put on your faja. But what if there is, say, an area of the skin that looks a little bit compromised? Well, it gives us the opportunity to deal with it before it becomes a problem. So we're able to give you some medications. One's called a cream called Nitrobid. We also give you an oral medication called pentoxifylline. And then that helps decrease the risk of the lipoburn. Sometimes we give supplemental oxygen directly to the area. But we're able to do all these things to decrease the risk, and we're able to identify it quickly because we don't wear the faja on day right out of surgery. You're going to put it on the next day. Next, seroma. Seroma is really probably the most common complication that we have. Not to say that it's common, it's less than 5%. And it's fortunately also the one that's not really a big deal. I mean, if you have seroma, then you have to do what's called a needle aspiration. You go in there with a little needle and you suck it out, and that's it. It's not a big deal, but it can be annoying. So we do want to try to reduce that risk as much as we can, and that's of course going to be dependent on getting your adequate massages. So we always want to make sure that you're getting a massage with a a properly trained post-lipo lymphatic massage therapist. Okay. And of course, proper use of your faja. You have to make sure that you're using compression so that we can prevent fluid accumulation and we can prevent the seromas, okay? And then I left this for last, but it's certainly not least. It's actually the most important thing here is that at Pure Plastic Surgery and with Dr. Alex Earle, there has been a 0 incidence of fat embolism, 0 incidence of BBL death, okay? 0, all right? Why is that? Because I am one of the pioneers of the use of ultrasound guidance for BBL surgery. I've been doing this since 2019. I got over 2,000 ultrasound guided BBL cases under my belt, okay? And never had an incidence of fat embolism or death because with the ultrasound, I turned a blind procedure into one where I could see. I see exactly where I'm placing that cannula. I can make sure it's in that safe space between the skin and the muscle. And I can visually see exactly where I'm placing that fat, okay, to make sure that we're not hitting any major vessels, all right? And so what makes us safer there? Well, yeah, the use of ultrasound guidance and, of course, the experience, okay? Like I said, thousands of cases. I've done probably over 3,000 BBLs altogether, over 2,000 of them with ultrasound guidance. And so then 100%, once again, 100% of our BBLs are done with ultrasound imaging or guidance, okay? So here we go. Now you know the secret. Of course, I'm telling all my secrets to our competitors out there as well, so I'm sure you guys are watching. So yeah, these are all our secrets. This is how we get our complication rates so low. And you know what? I don't care to give out these secrets because it's really at the end of the day, it's all about patient safety, right? And so I'm a true advocate for our patients, and I want all competitors to do this as well because we want to, decrease the complication rates, all right? And but you know what? The honest answer is that not all of them are doing it. Not all of them are doing it because not everyone is willing to spend the extra money, spend the extra time, and really walk the walk and not just talk the talk. But here you go. 100% of our patients do Vaser, 100% do Cell Saver. We change our cannulars 3 times a year. 100% get the UV light. These are all extra steps. They all get the VenaPro extra step, okay? And of course the ultrasound, 100% of our patients there as well, okay? And I've been talking for quite a bit, so I am happy to answer any questions.
This is a special one.
Special, yeah? Okay.
Yeah. Is this Alex Earle's dad?
Oh, no, man, Alex Earle. She stole my thunder. I used to be the #1 Alex Earle in Florida until she came around. But no, I'm not her dad. I do have a daughter though. My daughter's 17, but that's not her. But maybe you guys, we didn't talk about it. Did you guys notice a little something different? A little something else going on? Yes, that is right. It is Movember. Or No Shave November, some people call it. So yes, I do have the little mustache show going on for this month. And this is so that we all have a conversation about men's health, all right? Because men have health issues too. And so that's what Movember is all about, is kind of bringing men's health issues to the forefront. Anywhere from, say, prostate cancer to, men's mental state and kind of, psychological issues as well, from alcoholism to depression and all these things that are going on. So that is what Movember is all about, kind of bringing men's health issues to the forefront for this month.
Okay, for out-of-state patients, how long do we have to wait to fly back home?
So, no one can leave until at least post-op day number 5, okay? So in total, your visit with us is going to be at least a week, right? Because you're going to have your evaluation, your pre-op evaluation the day before surgery, and then you have surgery day, and then you have to be here for 5 days after that, which makes it a full week, okay? No one that's coming to have surgery under general anesthesia is able to leave before those 5 days. If you do leave before those 5 days, you're going to be leaving what we call AMA, against medical advice.
BBL with Lipo 360 day December 11 with you, Dr. Earle.
All right,
Really?
hey, that's coming up. I hope you're excited, and I'm looking forward to seeing you then.
Okie dokie. Will you be doing this for Tommy Talk, a Q&A?
Yeah, so we do these lives every Wednesday. It's called Hump Day with Dr. Alex Earle. I think that's coming probably from TikTok, right?
Correct.
Yes, so I've been doing it on Instagram for many years now, and so more recently we've been doing it on TikTok. But yeah, please make sure to tune in every single Wednesday. We talk about BBL, we talk about tummy tuck, we talk about all plastic surgical procedures. And then, yes, I'm happy to answer all the questions that you may have.
What's your thought on speeding stitches?
All right, what is my thoughts? My thoughts are that it happens, and it probably happens more often than most patients think. So it's actually something that I would say it's not unusual. On the flip side, it's not typically a big deal, but it can look sometimes a little bit scary to the patient because they first kind of see like this little red bump, and then they start feeling something, and then sometimes that little red bump can open, and a little bit of drainage can come out, and eventually your body kind of pushes that stitch towards the surface, and then that stitch needs to be removed, okay? And so I understand how it can be, sometimes a little bit scary for the patient. The good news is that it's typically not a big deal. So usually what we do is we remove the stitch, we then apply a little antibiotic ointment, and then after that your body should be able to take care of the rest.
Okay, patient asks, are these the same risk for getting Lipo 360 only?
About
the fat embolism.
Good question. So this is the same. So this is the same. Infection is the same. Actually, infection is probably higher with the BBL versus Lipo 360 only because we are doing the fat transfer portion of it. So I would say in general, infection rates are higher for BBL than Lipo 360. The bleeding and need for blood transfusions would be the same. The risk of blood clots would be the same. The risk for lipoburn would be the same. The risk for seroma, again, the same. What's definitely not a risk with Lipo 360, or at least much less of a risk with Lipo 360, would be the fat embolism, because of course we're not transferring any fat.
Okay. Any good news for removal of biopolymers?
Any good news? So unfortunately, once you have biopolymers in place, it is very challenging to remove them. So unfortunately, there's not a lot of great news in that sense. Really, the best thing that you can do is just avoid it. Of course, you never want to put in any sort of biopolymers. You never want to put any sort of like industrial grade silicone or anything that's really not meant to be in your body, and certainly not in the gluteal area. Okay, but say that train has left the station, right? It's already in. What's the next best thing? So yeah, the next best thing is to try to remove them. But unfortunately, they typically involve one or more surgeries, typically done under general anesthesia. It does involve incisions where you have to like cut and open and remove all the biopolymer that's accumulated there, plus all the scar tissue that surrounds it. And then usually after that, the patient's left with a deformity, which you then have to, at a later time, once everything heals, you have to try to fix it. So it is very tough. It's very complicated. I myself personally don't perform that procedure. There are other plastic surgeons out there that do it. So I would recommend that you find them and you go to them. But if once all the biopolymers have been removed, you need now basically a reconstruction, try to reshape the buttock or hip area, then we can potentially consider that case.
Can you do a second BBL with a stomach fat?
Yeah, so you can certainly do more than one round, okay? So your typical BBLs, your liposculpture 360, meaning you're doing lipo all around the trunk area, including the abdomen. And then if you need a round two, then a lot of times, yes, you can go back and do another lipo 360 around the trunk and the abdominal area, okay? Of course, everything is on a case-by-case basis, but most patients are able to do a second round.
Okay, Doug, if this live will be posted because she misses some answers.
Yeah, of course. So hear me out, everybody. First of all, the lives we do post on my Instagram, okay, and it lives there on the Instagram. But more importantly, if you really want to look at my lives plus those of Dr. Vidal, Dr. Wiggriff, you want to go to our YouTube channel. So please go to our YouTube channel. You go to YouTube, go to Pure Plastic Surgery. All of our videos are there. All of our lives, everything's categorized. You can find the answers to pretty much any plastic surgery question you can think of. We already have the answers there. It's super educational, so I highly encourage you to go to our YouTube channel.
Okay. Is Vaser included for all three doctors when they do BBLs?
Good question, right? You caught that when I said Dr. Earle included. That's right. I Dr. Earle, includes Vasers for 100% of my patients, like with 316 BBL. With Dr. Vidal and Dr. Wiggriff, it's not automatically included, but it can be added on. So if you're a patient of Dr. Vidal or Dr. Wiggriff and you want to add on the Vaser, please reach out to your coordinator so that they can do that for you and add that on. There is an additional cost to that though.
Do you still have the loyalty program?
Yes, great question. Where did that come from? IG?
Correct.
Definitely, we do have the loyalty program. Sometimes I'm surprised people don't use it more often because it's a great program. In order to use the program, you have to be in our Facebook group. So we have a Facebook group which is called Earle's Pearls Community. And so you go to the group and there are a few criteria that you have to fulfill. But yes, with the loyalty program, you can get huge discounts. I mean, even up to 30% of certain procedures. So please go to our Facebook group, ask about the loyalty program. We'll send you all the kind of the rules and criteria, plus all the great discounts that you can get.
Or you can send us a Clara.
Yes, if you're already one of our patients and you have Clara, reach out to us.
Okay, will my belly button be altered with Lipo 360?
All right, so the belly button is not altered itself in the sense like different than say a tummy tuck where we're physically cutting around the belly button and then sewing it back into the new opening created for the belly button to come out. But can it change some? Well, it can change in the sense that we are removing fat around the belly button, okay? And so while if a belly button stays it's like halfway of an innie, like an innie belly button, but then we remove that fat all around it, sometimes it can look or appear to be more shallow. Or say, for example, you have a small belly button hernia, which you at the first or the beginning you don't notice as much because there's all this fat around it, but then you remove the fat around the belly button, and that belly button hernia can then appear, can be more apparent. Things like that can happen. The other thing you have to be very careful with is in the way that you use your faja, right? If you don't make sure that the skin around the belly button is kind of splayed out before you put your foam and then your faja, and if you're always scrunching it together like this with your faja, well then sometimes that can cause the belly button to appear more like elongated after this procedure.
Doc, what are the right things to look out for when searching surgeons or when searching the right plastic surgeon online?
Wow, that's a whole live there, right? I could spend an hour just talking about that, and I have. So once again, please go to our YouTube channel, right? Go to Pure Plastic Surgery on YouTube, and you will see a full live dedicated to how to choose a plastic surgeon, okay? But let me just kind of go through some things real quick, all right? First of all, you want to make sure that your plastic surgeon is board certified in the specialty that you're looking for, which is plastic surgery. So not just board certified in anything, right? You want to make sure that your surgeon is board certified in plastic surgery, all right? That's just kind of like a cutoff, like a minimal standard that you need. You also want to make sure that they have quite a bit of experience with the particular procedure that you're looking for. So, for example, for me, I'm a body doc, right? You're not going to come for me for a facelift, for example. That's not my specialty. But if it's breast, if it's tummy, if it's lipo, if it's BBL, mommy makeovers, all that, arm lifts, and yes, I have tons of experience, thousands of cases under my belt. Another thing you want to look at is where is the surgeon performing their procedures, right? Are they one of these like high volume budget clinics? Well, you know there the standards are not going to be good. They cut corners, they have high complication rates, they're not going to take care of you after surgery. So you want to make sure they're doing surgery at a place that has high standards, such as here is Pure Plastic Surgery, and that their OR is certified at the highest level possible, which is the Joint Commission, okay? So you want to look at the certification of the OR where they're working. What else? How about their style, right? You want to look at their before and afters. Is that something that you like, right? Because different surgeons have different styles. So you have to make sure that their style matches what you're looking for, okay? And then of course, yes, you want to look at testimonials and reviews. You want to make sure they have, hundreds of 5-star reviews. And you want to go to their website and look at their gallery. Make sure that they have beautiful before and afters on there. So if anyone wants to look at a beautiful gallery, go to our website, www.pureplasticsurgery.com, and check out all the truly outstanding before and afters we have there.
Is there a certain amount of skin you have to have for a tummy tuck?
Yeah, of course. So not everyone's a candidate for a tummy tuck, but if you do have loose skin because of prior pregnancy most commonly, or massive weight loss, then you're going to have a lot of excess skin, and the only way to deal with excess skin is to cut it out, basically remove it via the tummy tuck. So when we do that evaluation, then yes, we are kind of pulling down. We have to make sure you have enough excess skin, to remove it all, so that we can pull everything down and leave your incision as low as possible.
What to look for lipo burns on TikTok?
Right, so for the lipo burns, well, first of all, your surgeon, whoever you're going with, they have to be very vigilant about this. And so that's why, like I said before, we don't put your faja on the first day. We examine you on post-op day 1, meaning the day after surgery. We take a look at all of your skin to make sure that everything looks okay before you then go ahead and put your faja. What are we looking for? We're looking for areas where it looks like the skin has been a little bit beat up, where it may not be getting as much nutrients and oxygenation as it should. Typically, it looks darker than the surrounding skin, but it is different than a bruise, right? It's not the same as a bruise. And so that's why you need someone who's like really has experience with these procedures to take a look at everything, because we can, like I can differentiate what's a bruise versus a potential lipo burn. But for like the general kind of layman's person, patient out there, it's hard for them to distinguish. So you want to go to a surgeon where you have a close relationship with them, where they're really looking at you all the time, making sure that we want to avoid complications as much as possible.
Okay, the last one.
All right.
Are there drains with Lipo 360?
Yes. So for me, yes, and for our surgeons here at Pierce, for Dr. Wigriff and Dr. Vidal, we all like to use drains for your Lipo 360. It's typically one drain in the lower belly area, and we remove it when you come for your visit on post-op day 5. Okay. That's not to say that every surgeon out there uses drains. Honestly, for liposuction, it's a little bit more elective in that sense. Different surgeons have different preferences. But I like to use a drain because I think it really helps remove a lot of that excess fluid which you accumulate in the first 5 days. Okay? All right, everybody. So, yes. Oh, yes. All right. I was about to sign off, but I almost forgot to mention, very, very important. As you all know, it's towards the end of 2024. And guys, I am almost done for the year. I only have 5 spots left for 2024. And then that's it. We're done up until 2025. So if you want to have your surgery this year, and if you want to have a special pricing for that surgery, we only have 5 spots left, new bookings only, and they're going to go like hotcakes. So you better call or reach out to us today, because otherwise they will be gone. And then you won't be able to get a surgery with me until March of next year, and prices are going to go up. Okay? So reach out to us today. All right. I look forward to seeing you all next week on Hump Day with Dr. Alex Earle. Ciao.